I wanted to commend you all for coming today and being very proactive about your gut symptoms. I think in today's day and age, no one should have to live in silence and suffer with their gut symptoms, but sadly, so many people do. So it's great that you've spoken up and said, look, I need to do something about this. Now, over the next 15 minutes, I'm going to whiz through one of the chapters in my book, Eat Yourself Healthy, focusing on how to manage IBS. But before we zoom into IBS per se, I think it's important we take a step back and look at gut symptoms in general. Because, whether we like to talk about it or not, gut symptoms will affect every one of us at some stage. If you have a really large meal, yes, you're going to get bloating. That's completely normal. If you have a big curry, very spicy, and you're not used to it, yes, you might get a slightly looser poop. Again, that's quite normal. However, if you're getting gut symptoms at least once a week, and it's really starting to impact your quality of life, and you've had it for several months, that is not normal, and that is something you shouldn't have to live with. Now, if you're having those sorts of symptoms, it's really important your first port of call is going to your GP. And this is because gut symptoms can mask underlying other diseases like celiac disease, like inflammatory bowel disease, and like colon cancer. So it's really important that you do pay your GP a visit. Now, once you've seen them and they've gone through a lot of the testing, and actually I've listed here some of the red flags. So if you have these red flags, it's even more important you go straight to your GP because it is suggestive maybe there is something else going on. Now, once your GP has done the test, if he finds, or he or she finds that there is nothing structurally wrong, then it is likely you have what we call a functional gut disorder. Now, I know that sounds rather sciencey, but what it means is that structurally, everything looks normal. The structure of your gut looks fine, and that's why the tests have come back normal. But the function, so how things move, how the hormones are released, how the gut and brain communicate, seems to be dysregulated. So there's something not quite right there. In fact, our understanding of these functional gut disorders now is that there is, the underlying mechanism is that there's a dysfunction between the gut and the brain. So everyone's gut and brains are constantly speaking. Now, when you have one of these functional gut disorders, it's thought that communication is dysregulated. So there's many different types of functional gut disorders. You can have functional diarrhea, functional tummy pain, heartburn, constipation, bloating, and one that is, overlaps a lot of them is, of course, irritable bowel syndrome. So irritable bowel syndrome fits under the umbrella of one of these functional gut disorders. So what is IBS? Well, historically, sadly, it was thought just to be people who had slightly irritable, gut. But we now have very strict diagnostic criteria that you need to meet in order to get this diagnosis of IBS. And that includes getting stomach pain at least 1 day a week and having that for an extended period of time. Now that's the one. The other criteria is that your stomach pain has to be related to your pooping experience in some way, whether pooping makes it worse or makes it better, or it comes on when your poops are either hard or loose. And the other criteria is that you had to have those symptoms ongoingly. Now, I actually see quite a lot of people in my clinic who have a lot of different gut symptoms, but they don't have stomach pain. And that means they probably just have another functional gut disorder like functional bloating or functional constipation, and they don't actually fulfill the criteria for IBS. And knowing that actually changes my advice just slightly. So it is important to kind of find out where you fit on this kind of diagnostic criteria, so to speak. Now, with IBS, there's 4 main types of IBS, and it's really simple to determine what type you are. What you do is simply look at your poop. So what sort of poop is yours predominantly? Are you more towards the hard type, in which case you would be IBS constipation predominant, or the loose type, or maybe you're mixed in between? And there's another type called unspecified, where your poop actually doesn't change that much. So who has IBS? Well, IBS certainly doesn't discriminate. All of these people are thought to have it, along with a huge percentage of the population. And not just in the UK. Buzz was right when he said it is everywhere, because we look at the global map, you can see here the prevalence. So the number of people living with IBS is huge across the globe. Now, what I think many of you want to hear about, what do I actually do? So what's the different dietary management aspects? Well, my first thing whenever I see someone, again, is to make sure they fulfill the IBS diagnostic criteria. So they would quickly go to their GP, get those tests sorted. I'd also have a quick scan just to make sure they don't have any of more common food intolerances. And I think some of you are doing some of the breath testing for lactose intolerance. So that is the milk sugar. And that can be quite common in certain types of ethnicities. So that's something I quickly look at, is people only having symptoms when they're having lactose, so the milk in their diet. And in fact, in my book, I talk about ways in which people can assess whether they have one of these food intolerances, like lactose intolerance, because not everyone has access to these kits. And you don't necessarily need them. You can simply do things like this 3R process, where you would record all your gut symptoms as well as what you're eating. And then you would look if there is any association between a particular type of food and your gut symptoms. If so, you would then restrict it. That's step number 2. You take it out of your diet for 4 weeks. And then the third step, which is really, really important, is actually reintroducing. And you want to see whether when you reintroduce, you actually get those symptoms back. So once we've gone through this diagnosis process and we go, yes, it looks like it is IBS, I would then take a person through first-line dietary management. And you can see here things like alcohol, caffeine, spicy food, fatty food, etc. They're listed here because they can all affect how our gut moves. Now, they don't just affect people with IBS, they also affect people without IBS. However, with IBS, because you have that more dysfunction between the gut and the brain, your gut is quite sensitive. So any change in movement, any change in hormones actually triggers your gut to communicate with your brain and activate things like your pain sensors, which kind of exacerbates the effects of these food groups, which do influence everyone's guts. So around 50% of people would actually get symptom benefit from following just this first-line dietary advice. So looking at these common triggers and cutting them out of their diet, or finding how much they can have. But if you don't respond to that, then I would take a person through this second-line therapy. Well, not everyone. I would identify whether people are appropriate for it, because there is some risks with going on a low FODMAP diet. So who's heard of a low FODMAP diet? Yeah? Pretty much everyone. I think it's becoming something, a lot more common, and a lot of people are Googling it. But Googling the low FODMAP diet is extremely dangerous, because it doesn't give a very fair perception of irritable bowel syndrome and how to manage it with the low FODMAP diet. So FODMAPs are essentially, the word is an acronym, which stands for all of these very sciencey names, and essentially they're just different types of carbohydrates. Now, if you have a look at the foods they're in, they look quite healthy foods, things like legumes, whole grains, fruits, veg. So people are like, why would I cut them out? Now, the thing is, these FODMAPs, yes, most FODMAPs are quite healthy for people to include in their diet. However, with irritable bowel syndrome, when you have that sensitive gut, they can trigger some of those symptoms. So how do they actually trigger the symptoms? I think one of the important things that we need to understand is, firstly, what happens to food when we swallow it. I think we start to get very fixated on what we're putting into our bodies, but as soon as we swallow it, most of us have no idea what actually happened. So think of whatever you had for breakfast this morning. Well, after you chew that, it goes down your food pipe, your esophagus, into your stomach, and it sits there for a couple of hours, and your stomach is very much like a washing machine. It only physically chucks around your food. It releases like detergent and digestive enzymes, which help to start to clean it and break it down. Now, once your food's kind of like a puree consistency, it makes its way into this long, windy part called your small intestine. A very weird name, because it's not small, it's 6 meters long. But this is actually where most of your nutrition from your food gets from your gut into your blood to go and feed all your cells. But not everything is digested there. Some things like FODMAPs don't quite get digested there for many different reasons, and they make their way into the large intestine. Now, this part here, the large intestine, also known as the colon, is where we have those trillions of bacteria, which we collectively call our gut microbiota. Who's heard of the gut microbiota before? Yeah, about 50% of people, great. So this is really where the research has started to explode. And I think as done a lot of justice for IBS, in that people are becoming more aware of IBS because of this research around the gut bacteria. So we actually contain more bacteria in us than we do human cells. So they have such a big part in our body. They produce a range of different hormones, minerals, vitamins, etc. So they play a really big role. And what they can also do is communicate with our brain. So when these FODMAPs are ingested, they're not very well absorbed here. So there's two main mechanisms that can trigger symptoms in people with IBS. The first one is they can actually draw, because they're quite small molecules, chemicals, they actually draw fluid into the large intestine. So they draw water from the rest of our body into our gut. And that can put a lot of extra pressure on the intestine. Now, the second element is that the bacteria love to ferment FODMAPs. So when they enter here, the bacteria go a little bit crazy and eat them. And one of the things that bacteria release when they ferment foods is gas. Now, that's not necessarily a bad thing. In fact, these two mechanisms actually happen in everyone when they have FODMAPs. It's just that people with IBS have that sensitive intestine, and the scientific word is colonic hypersensitivity. So you've got a very, very sensitive intestine. So when this happens, you can actually feel it, whereas someone without IBS, they can't feel it. So this sort of stuff sends the messages up to your brain and your pain pathways. Also, quite interesting, studies have shown that messaging up to your brain can cause your diaphragm, so your breathing muscles, to push down, and your external gut muscles to relax subconsciously, so you don't even realize you're doing it. And that's why some people with IBS actually get that visual distension. It's not that you actually have more gas inside you than someone else. In fact, we've scanned people's guts using special technology and looked at the amount of gas. So it's not that you have more gas in you, it's that you've changed how you're breathing to accommodate the messages up to your brain that you need to allow more space there because of the activity that your body is feeling. So the thing with the low FODMAP diet is actually it's a process. It's not just a single diet that you follow for a long period of time. The low FODMAP diet, the strict element of it, should only ever be followed for 3 to 6 weeks. And the reason for that is that FODMAPs are actually prebiotic. Most of them are prebiotic. Now, prebiotics feed the good bacteria. So they nurture the bacteria and make the bacteria really happy, sending positive messages throughout our body, our brain, our heart health, all that sort of stuff. So we want our bacteria to be happy. We want to feed them these prebiotics. But remember, there's that knock-on side effect with having too many prebiotics, is that it activates that sensitivity. It doesn't cause the sensitivity, but it triggers that sensitivity in people with IBS. So the premise of this part is really just to give your gut a little bit of rest for the 3 to 6 weeks. In this time, I usually recommend an additional therapy which shows to target that dysfunction between the gut and the brain. And I'll talk about that soon, but that has nothing to do with diet. So I usually combine diet and non-diet strategies together to get the optimal benefit. So here you've got the gut rest. And after you've had that gut rest, around 70% of people will get that symptom benefit, so the symptoms will resolve. We then move on to this stage called the reintroduction stage. Now, I should highlight that if you go through this process and you don't get symptom benefit, then you should return to your normal diet. So you should reintroduce all the FODMAPs and we would look at a different pathway for you. If you do respond, that's when we go through this reintroduction phase, where we would look at the different groups of FODMAPs and we would systematically challenge you with different doses over several months. So it's quite a process to go through. And essentially we identify what your threshold is. So how much FODMAPs can you actually include in your diet? The really key thing is FODMAPs aren't like allergies. Everyone, even people with really, really bad IBS, can have small amounts of every single food. It's about the dose. And what I find is that the more people do these non-diet strategies, they can actually increase their FODMAP threshold. So they can actually tolerate more if they can really help desensitize that overactive gut-brain axis. And then the third stage is around this personalization, where it's no longer low in FODMAPs. It might be, moderate in FODMAPs, whereas before you're having super high. But it certainly does have sufficient FODMAPs in it to feed the gut bacteria. So this is really where we're aiming to get you at. And what I find is that, again, with those non-diet strategies, over about a period of a year in clinical practice, people typically get to a stage of being able to go back to having, unlimited FODMAPs in their diet. And that is, I think, important for long-term health. So what's the evidence for low FODMAP diet? You don't need to become a scientist to try and understand this, but what this is, essentially, each line represents a single clinical trial. So this here we call part of a meta-analysis, where it pulls together all of the evidence from each individual trial, and all of these trials included around 500 people in total. And what it looks like, what is the overall benefit? Not just looking at a single trial, but across these, I think there's about 10 studies done at the time. What's the overall benefit? And it suggested that around 70% of people get that symptom benefit from following the low FODMAP diet. Now, it is important to highlight that all of these studies actually used a dietitian. And this highlights the point that the diet is super, super complex. All of the information sheets online, unfortunately, if you just go to Google, aren't complete. And that leads to people being over-restrictive with their diet and can lead to nutritional deficiencies. And also, the low FODMAP diet certainly isn't for everyone. For some people, it can actually trigger eating disorders. So it is really important that you don't just, go follow the information online, because it's not going to be complete, and it's also quite risky and can do that long-term damage to your gut bacteria if you're on it for a long period of time. Now, knowing that, this looks very, very busy, but in my book, I have actually developed something that I use with a lot of clients who don't have very severe IBS, but I know would benefit from what I call a FODMAP light approach. So it's not following the very, very strict diet, but it is following a subset of the diet where there's a number of foods that are higher in FODMAPs. So I would take them out as a first point. And we go through the stage 1, stage 2, and the stage 3 personalization. So it's following the same pathway, it's just reducing down the number of foods that you need to restrict. And like I said, for many of my clients or patients who have very busy lives and only have mild IBS, this is sufficient for them. Can probiotics help? Well, if you look at the marketing headlines, yes. But if you actually look at the evidence, maybe it's not as clear cut. So again, this is another one of those meta-analyses. Remember, that's where they pull all the individual studies together. So from these, I think there's about 30 different studies, which included over 3,000 patients with IBS. They found that yes, there is a benefit of taking a probiotic. In fact, if you just go and take any probiotic, you've got a 21% chance of reducing your symptoms, which actually is not that great if you think about the costs of having to buy a probiotic, and you essentially have to buy 5 different types before one's going to work for you. Now, this highlights a really important point, that each probiotic is actually very different. We need to start thinking about probiotics kind of like vitamins. If you've got iron deficiency, you're not going to go and take a calcium supplement. It's the same with probiotics. If you've got IBS, you should take the specific strains or types of probiotics of bacteria or yeast that has shown a benefit. So you can see this line here, that one there. Now, if this line is crossing it, then that means there's no benefit. Here, if it's on this side, it means it favors the probiotics. If it's here, it means it favors the placebo, the fake intervention. So if you look each trial, they've all used different strains or different types of bacteria. So if it was me, I certainly would like to take this probiotic and not be stuck with this probiotic here which showed no benefit. So it's about knowing which types of bacteria have shown that clinical benefit. And again, in the book, I help people identify which different strains and therefore which brands there has been clinical trials to show that benefit. Right, now this is, for me, one of the most important aspects of helping people get through IBS. Not just managing their symptoms, but actually getting that long-term symptom resolution. And it really comes down to the recent evidence which has shown that, IBS, the underlying mechanism, is related to the dysfunction between the gut and the brain. So there's been some really interesting clinical trials now looking at ways we can desensitize that overactive gut-brain axis. And this study looked at that low FODMAP diet, which we typically call that, gold standard diet, or they compared it to this gut-directed yoga flow. So they randomized people to either getting the diet or getting this yoga flow. So this flow they didn't change their diet at all. And they had that intervention for 12 weeks, and they got them to come back and found that both interventions had equal effectiveness. One group changing their diet, going on a very strict diet, one group not touching their diet at all. Now, I think this sort of information highlights how powerful tapping into the gut-brain axis really, really is for IBS. Now, one of the things about that gut-brain axis is, depending on how long you've had your IBS for, it can take a little time to work. So in clinical practice, what I usually do is to help people get that short-term relief, because I don't want people suffering any longer than they have to. I would put them on either the FODMAP light approach or a full low FODMAP diet, as well as getting them to tap into that gut-brain axis, whether it's through things like the gut-directed yoga flow. And again, in my book, I've got a little morning flow that I get a lot of my patients and clients to do, or things like mindfulness, things like the Calm app or Headspace app. Doing that every single morning for 15 minutes, I have found really, really does increase people's chances of being able to have a lot more FODMAPs in their diet when they go to stage 2. So tapping into that gut-brain axis is really, really important. So the take-home messages, I think you already know about those red flags, but don't suffer in silence. So you guys again know about this, but if you know anyone else out there who's got IBS, encourage them to do something about it, because we do have the evidence now to show that there is a number of different therapies that can help. It is important to realize that food is quite complex, so don't just go and Google solutions, because it can be really confusing. And I often see people in clinic who've actually cut out so many different things, and their anxiety is even worse around food, which is actually is a bit of a vicious cycle for people with IBS, because that triggers more that gut-brain axis over sensitivity. And the last thing is around the holistic approach. So I really, really believe that it's not just diet. It is a combination of diet and lifestyle factors like the yoga flow or the Headspace and things like that. So I will leave you there, and if you have any questions, please ask away.
I'm interested that you have the elimination phase of the FODMAP diet at 3 weeks. I've seen a dietitian on the NHS, and I was told 8 weeks, and I just simply couldn't do it. I just simply couldn't. I couldn't eat anything. Yeah,
it can be really, I think it's really important that we do adapt according, to people's circumstances, particularly if you've got kids, you've got a busy life, you don't have hours to prepare these low FODMAP meals. So the 3 to 6 weeks actually came from looking at all the different clinical trials, where some trials looked at the benefit at 3 weeks and found a significant benefit. So what I usually say to people in practice, try it for at least 3 weeks. If you start to feel a little bit of benefit, I would push that out to 4 to 6 weeks. I wouldn't necessarily recommend 8 weeks straight up to anyone. It's very overwhelming, isn't it?
I find sometimes with diet you can get away with eating an entire pizza at Franco Manca, and then some days I eat perfectly but I don't sleep that night, and then I have a horrible day the next day. So I've kind of lost confidence in diet as something that's going to work. But
And that's exactly why I focus not just on diet, because the important thing with IBS to realize is that diet is not causing you to have IBS. Diet can just be a trigger, but other things can be a trigger, like a lack of sleep will change your hormones, so it can increase your stress hormone cortisol, which again will make you even more sensitive to eating anything, even something that's low FODMAP. So yeah, it is important to realise that it's not like a food intolerance where it's actually it's the food's fault. It's the fact that you have that gut-brain dysfunction and you need to be very gentle with that. So, if you want to try the 15 minutes every morning or the, gut-directed yoga flow, I would really, really recommend keeping with it for the 8 to 12 weeks where we've seen the clinical benefit. And then you'll probably start to realise that, actually maybe on those really, really stressed days, you'll be more conscious of what things will trigger you, but it's not just the fact that it's the food. And hopefully over time you'll have less of those really, really bad days, because even if you do eat, a whole pizza, that sensitivity will be, a lot lower, so it won't trigger you.
In the journey of discovering what's going on with your gut, how much value do you put on food intolerance tests?
Yeah, so that's a really, really good question. And the only food intolerance test that's got significant evidence for it is the lactose intolerance test, so the milk sugar, in which there is good evidence to show that the breath test can identify that. But that's actually why I developed that 3R approach, because that's what we do in clinical practice, and that's what we would consider the gold standard to identifying a food intolerance, where we would record people's symptoms and look if there's any correlation between certain food groups and their symptoms, and then we would take that out of their diet, and then we would spike them and challenge them again. So that's the process which has the gold standard evidence for it, rather than the test. In fact, the pinprick test, there is no evidence for it. And, I have had colleagues go and just do the test because they got given it for free and found that they're intolerant to like 10 different foods and they eat them on a daily basis, doesn't harm it.
Because I'm at that stage where I'm getting offered different advice of what to do.
Yeah.
And I've heard so much sort of opposing views on it. And it just, in some degree it seems like a money-making scheme. It's just like, go pay 500 or 250 quid for something that's pointless. But
it is 100%.
What about a stool test then? Someone said that's quite effective too.
Yeah, so that's another really interesting area. And in terms of where the science currently is at, because a lot of patients, clients come to me with the stool tests, and I look through and go, oh, this is really interesting, but it doesn't actually change my clinical practice at all. Because one of the things we're finding out in research, where, at King's, where I work as a research fellow, is that the same bacteria can act very different depending on the environment it's in. Similarly, very different bacteria can actually do the same things. So by getting these tests and just looking at what bacteria are there, it's actually not telling us a lot. And in my work at King's, we're actually looking at the chemicals the bacteria are producing is probably more indicative of what they're actually doing. So I do believe, though, in the next couple of years, we'll have more evidence to be able to use these stool tests. But I think at the moment, the companies are kind of ahead of where the science is at. So I wouldn't spend your money on them. But they're not dangerous, whereas I feel like these food intolerance tests are really dangerous, and that they're telling people they're intolerant and they're cutting foods out. And I've seen people come, on 10 safe foods, super malnourished, and they're just so anxious around food because they believe, because of these tests have told them that they're intolerant. And I think that's very, very dangerous.
How significant do you think is weight loss, or just weight loss for your symptoms? So I used to be like a stone heavier, which I've now lost, but I still find the symptoms to be the same.
Yeah.
Is that?
Yeah, so there's no real relationship between what people weigh and the severity of their gut symptoms.
Right.
I think they're very much two independent things. But yeah, that is something I hear quite a lot, where people think, oh, if I lose weight or I get healthier, then my symptoms will improve, and that's not necessarily the case. Yeah.
But actually, what I've been told is the opposite, funnily enough, because I was diagnosed as pre-diabetic, and it's when I lost weight, and I was also partly on FODMAP, and also became vegan and sort of vegan keto in order to actually stimulate the whole system.
Yeah.
That's when I got better, and at the same time from the food diabetes, and also at the same time the gut.
Oh, brilliant.
And what they were telling me was that because a lot of people are overweight, they don't know that they're pre-diabetic, they're walking around and they are pre-diabetic, and that puts a massive stress on all your hormones, because your liver is overworked, your pancreas is in trouble, and your blood sugar is too high, therefore your blood is too thick, therefore you're also over acid, actually it does make your IBS a lot worse. So there actually could be a major link between being overweight and IBS.
Yeah, so
Sorry.
No, absolutely. No, that's a really good point. So if you do have other comorbidities, so other conditions like being pre-diabetic, then absolutely getting your health under control, which means in many cases, specifically with diabetes, losing a little bit of weight in a healthy way certainly can improve your overall health. And we know that our gut is connected to the health of pretty much every organ. So if we get the pancreas not overworking, then yeah, of course, that certainly could improve your gut symptoms. And we do see some people with more late stage diabetes, they do have a slow moving stomach, and we call it gastroparesis. When they eat food, because the blood doesn't circulate quite as well, food gets stuck in their gut, and that can lead to gut symptoms. So in those scenarios, absolutely. But I think generally for you, if you don't have any comorbidities, the weight thing is probably not the solution. I wouldn't go out there and tell everyone to lose weight to control their IBS. But in that scenario, yeah, that's a really good example.
I think the thing is a lot of people are actually undiagnosed with high blood sugar. You don't have to be pre-diabetic to already be stressing the hormone in the gut system.
Again, which is why going to your GP as a first step to make sure you get the right diagnosis is a really good idea. Yeah.
One of the things I find difficult is in terms of the foods that I think I should avoid because I think they upset me. I can never quite tell which, and I know this is why you do FODMAP and the restriction, which foods it is that are upsetting me. How quickly would you expect the reaction to be from ingesting a food? Because I spend half my time thinking, well, was it what I ate last night, or was it, what I drank this morning?
Yeah.
What is it? It could be anything.
It can be so difficult because, as the lady was saying before, some days she can handle a whole pizza and other days she can't. So it's not necessarily just that food. But if we think about digestion, it can change in terms of the time, but anywhere between, so essentially when it gets that large intestine, that's kind of where people typically get the symptoms. So anywhere between 4 and 8 hours can be when people start to get symptoms. Or another element is when people actually just go to eat. What that does is actually triggers this gastrocolic reflex, which is a little bit sciencey, but what it does is it causes your small intestine and your large intestine to kind of push food further into your large intestine where the bacteria are. So sometimes when people eat straight away, they start to get symptoms and they go, oh, it must mean what I was eating, when actually it's that gastrocolic reflex moving the food that you ate 8 hours ago or 6 hours ago lower down. So it can be hugely confusing, and I think that's why with the low FODMAP diet, we do it very systematically, and that we would cut them all out and then we would challenge over 3 days, which, can be really quite burdensome. But what I would recommend again is going and really trying to relax that gut-brain axis, because I find that will steady out the number of foods that you seem to be having that reaction to. And yeah, the more fixated we get on the food, sometimes the more foods can actually trigger the symptoms. So just being quite careful there.
Could you shed some light on the relationship between hormones as being contributory to IBS and IBS symptoms?
Yeah.
Because, if someone says to me, when did you think your symptoms start? I feel like saying, when I first started my period, so at the age of 14, 15,
Yeah.
And ever since then. So I'm wondering if there is a connection or if it's contributory to it.
Yeah, we certainly do see an association, which is why females tend to have a higher rate of IBS than males. We don't exactly know the mechanisms of how that works, and it could actually just be a coincidence that also when you get your period, you may have more stress in your life. You start to get more conscious of other people, and we know that things like having severe mental or physical trauma can also increase your risk of getting IBS. So as well as things like antibiotics, etc. So it could just be, a coincidence that happens when you hit puberty, that you are under more stress and pressure, and also, going through school at that stage. That's when you start to have to check your grades and things like that. But we don't exactly know the mechanisms. Adam, do you have any insight on?
So I think in terms of mechanisms, so there is this disparity between males and females in terms of overall IBS prevalence. IBS with constipation is probably more common in females than it is in males. It's probably the other way around for IBS with diarrhea. But the prevalent thinking is that as the changes particularly in progesterone over the course of the menstrual cycle, winds up that pain hypersensitivity. So that's often why symptoms are worse, particularly in the premenstrual phase of the menstrual cycle. So that's a theory. It's never been well proven to the best of my knowledge, but a lot of my patients say that that's the sort of time that their symptoms get more severe, and progesterone probably speeds up the colonic transit.
Yeah, and that's also why there's a thing of period poops. So around our periods, most people slightly get looser poops, and that's related to the changes in the hormones. But when you're talking about going from from a child to an adult, those sorts of hormonal longer term changes, I think we need to do more research in that space.
What's your view on leaky gut and adrenal fatigue and things like that?
Yeah, so the thing with leaky gut is that it's not really a black and white thing. In fact, we all get a leaky gut from time to time. If we have a really high-fat meal, our gut gets a little bit leaky. If we have alcohol, our gut gets a little bit leaky, just short term. In fact, if we're really, really nervous, our gut gets a little bit leaky. So I caution people who've been necessarily diagnosed with leaky gut. I like to think of leaky gut more of a symptom. So if you have celiac disease, which is an autoimmune condition to gluten, where you can't have gluten, your body starts to attack your own gut if you eat gluten. If you have undiagnosed celiac disease and you're eating gluten, then your gut certainly can become leaky, which means that the cells which line the gut, actually the gap between them is bigger, which means things can actually get into your body. So normally that gut lining is really tight. So in that scenario, leaky gut is a symptom of celiac disease and having gluten on it. But as soon as you take that gluten out of the diet, then your leaky gut heals up. So it's more of a symptom. I wouldn't ever really think it's a diagnosis, so to speak.
Okay.